Thank you. All right, well, welcome everybody. This is the second info session for Childcare Health Consultation Service Delivery Request for Proposals. I'm very excited to have you all here today. My name is Lucy Dong. I use she, her pronouns, and I'm the program manager for the strategy area. And I will go ahead and share our agenda for today. So I'll go over a brief overview of Best Starts for Kids for anybody who's unfamiliar or anyone watching the recording later. And then we'll talk about what is childcare health consultation very briefly. And then the bulk of the discussion today will be about reviewing the key elements of the request for proposals. And then we'll have questions and answers at the end. Just a quick logistics piece. If you have questions, I would appreciate it if you just pop them in the chat as we go along so you don't have to keep thinking about them or forget them. And then at the end, if there's anybody joining by phone, which I don't think there is, we can also unmute and let folks ask questions. And I'm here today with Hannah Hamid, who's one of my teammates. She'll be helping moderate the chat. And then Phil Thompson is our contract specialist, and he is the key contact for any further questions for this request for proposals. All right, so Best Starts for Kids. It's a 6-year levy that's started in 2016, went through 2021. So that's the first levy, and what you'll see me sometimes refer to as Best Starts for Kids 1.0. And now it's been renewed for another 6 years. So we're in what we call BSK 2.0 starting 2022. And the vision has stayed the same throughout. It's that we want to see babies born healthy, kids thrive, and young people grow up to be happy, healthy, successful adults. And so you'll often hear a little tagline, happy, healthy, safe, and thriving. And that's really the core of all of our work. Just as a quick overview for the Best Starts for Kids 2.0 levy that runs 2022 through 2027, there's a number of different investment areas. I'll just pause for a second so you can read through. One thing you might notice is there's a childcare investment. I just want to highlight that childcare health consultation actually doesn't fall in this first bucket. The childcare investment comes as a new thing for BSK 2.0, and that's more focused on childcare subsidies and a pilot wage boost program for childcare providers. Our work actually falls into investing early, so that's the prenatal to 5 work. Which is 50% of the remaining levy after these first 4 amounts are taken out. And so Best Starts for Kids prenatal to 5 actually encompasses a number of different program areas. And I like to think of it as there's direct services, and then there's kind of a number of other integration strategies that we work with to bring these key components into the direct services that we offer. And so my team does the direct services. So we try to reach children and families wherever they are in their lives. So through the home and home-based services, so things like home visiting, and then to in the community, so through community-based parenting supports, and that's the body of work that Hannah manages. And so that's things like basic needs, parenting classes and parenting groups, and perinatal and lactation supports. And then we also reach children and families in childcare, because that's where children spend a good chunk of their time when they're not with their parents or their primary caregivers. And so that's my body of work, childcare health consultation. And one thing that I would like to highlight that's slightly different between childcare health consultation and these other 2 direct service strategies is that home-based services and community-based parenting supports are working a lot more directly with children than the primary caregivers, whereas childcare health consultation is the services are focused on the childcare providers and making sure that they have the support and the skills they need to be providing the best care possible for the children that they're responsible for. All right, and so some of you might have seen this video. It was posted in a blog post, but I'll play it for anyone who hasn't. It's a quick 2-minute video about what childcare health consultation is, and it was created by our partners at Kindering Center back in 2020, and informed by a lot of community stakeholders and folks in the childcare sector. So I'm going to go ahead and play this. If you're not able to hear, just let me know and I'll try again.
Childcare Health Consultation is a collaborative partnership between a trusted childcare health consultant and caregivers or childcare providers to promote the optimal health, safety, and development of children in their care. Childcare health consultants may include community health professionals, mental health specialists, nurses, nutritionists, health educators, or inclusion specialists. Consultants work with people who care for young children, including family, friend, and neighbor caregivers, family home providers, and center-based childcare programs by providing one-on-one consultations, trainings, and resources at the caregiver or provider's request. Examples may include supporting the completion of developmental screenings, including making referrals and supporting follow-up with families, training on best practices for safe sleep, and developing strategies to support children in care who have special healthcare needs. Childcare providers and caregivers report that partnering with a childcare health consultant increases confidence and abilities to improve health outcomes for children. Childcare health consultation leads to reduced numbers of suspensions and expulsions, which disproportionately affect young children of color and children with disabilities. Current services in King County are provided in a number of ways by entities and individuals with a variety of backgrounds and experiences.
All right, so that's the quick overview of childcare health consultation. And then I wanted to share some kind of background and a little bit of history on childcare health consultation in King County for anyone who's not familiar. So childcare health consultation in King County predates Best Starts for Kids by far. We actually have a team that's within Public Health Seattle King County, so in the same department that I'm in, that's called the Childcare Health Program, and they've been providing childcare health consultation services for 30 plus years. It might be 35 years by now. And before 2009, they actually served childcares countywide. And then unfortunately, due to some budget cuts with recession and things like that, their teams reduced a little bit, and they're more limited now to serving the city of Seattle sites. And then, of course, through the years, there have also been private nurse consultants that provide the service as well. And then Best Starts for Kids came along back in 2016, and the previous program manager who was in this role had to really re-envision what the childcare health consultation services that Best Starts for Kids invest in could look like. And so there was a lot of development in 2016, 2017. And then in 2018, we funded 7 different community-based organizations to deliver these services. And the idea was to really expand the services to reach communities that previously weren't being served or weren't being served in a way that was really culturally and linguistically appropriate. And so these 7 programs really ended up having each their own unique model that was developed for their focus community. So in BSK 1.0, some of the focus communities are shown here in the little bubbles. So we had programs focused on Somali licensed family childcare home providers, Chinese family friend and neighbor caregivers, East African and African American family friend and neighbor caregivers, and then focused on the particular needs of children, so providers serving children with special needs, and then some focus based on geography as well. So program that's focused in East King County, so the rural childcare providers that often have the less access to the resources. and then South King County childcare providers as well. So that's something that you can start thinking of as you think about your focus community for the proposal this time around. And then before we get too far into this, I do want to clarify a few childcare provider definitions. So when we're thinking about childcare providers in this body of work, we're trying to think of it in a more encompassing way. So it's not just, childcare centers that are those larger facilities with multiple classrooms licensed to serve children birth through 12. We're also thinking about home-based care. So family childcare homes that are licensed to provide childcare for 12 or fewer children within the home or the residence of the licensed childcare provider. And then also family, friend, and neighbor caregivers. So these are folks like the grandparents, the aunts, uncles, neighbors that are taking care of the children a bulk of the time. And oftentimes they're not paid for that work and they're legally non-licensed and not regulated by the state. So oftentimes they don't even think of themselves as childcare providers, but they're still serving that really critical role. So we're including them in this definition of childcare provider. And I do want to highlight this quote from DCYF that both in Washington and around this nation, family, friend, and neighbor care is the most common type of childcare for infants and toddlers and for school-age children before and after school. So again, it's a really critical type of childcare and hasn't previously been kind of centered in services for childcare providers. So we want to really highlight that. Now I'll just go into a summary of some of the key elements of the request for proposals this time around. So the funding we have available is around 7.9 million, and that would be across all funded programs for 3 years. So that's 2023 through 2025. The application due date is July 27th. So about 1 month, 5 weeks from now. I need to do my math, but the total application is open for 6 weeks and it'll be due 2 p.m. July 27th. Again, contract period is for 3 years. January 1st, 2023 is the start date. And then December 31st, 2025 would be the end date of the contract period. There is also a possibility for extension for programs in good standing as long as funding is available. So there could be a reevaluation process in 2025 for the funded programs. Funding request limits this time around is $175,000 to $550,000 per year. So that's something to keep in mind as you propose your budget for the application. And the anticipated number of awards this time around is 5 to 10. So this is the timeline for the RFP process. This is also in the full RFP document if you ever need to revisit it. But again, the RFP was released last week, June 15th. We are having our second info session today, and then we do have an upcoming webinar that I encourage you to attend. It's hosted by Cardia Services, which is our evaluation partner. They've done a lot of deep dive work with our partners over the last several years to really look at the types of services being provided, what's in common with these services, what's different, and what are the outcomes from the services. And so this lunch and learn is going to be July 7th, 12 to 1 p.m. And I'll paste, let me pause for a second and paste the link in the chat for anyone who wants to read more. And the latest report is also now available on the Best Starts for Kids reports page. You might want to mark your calendar for July 18th. That's the final day to submit questions via Zoom grants or to Phil directly. And then the final day to initiate a request for technical assistance is about 1 week before the application is due, so July 20th, 2022. Again, proposals will be due on July 27th, 2 p.m. And then we'll immediately start reviewing the responses. So right after that, July 28th through the end of August. I'm not sure if we'll do interviews yet for applicants. If the review panel decides that that makes the most sense, if there's any applicants they're really debating between or anything like that, then we might do interviews, and that would also happen in August. And then we anticipate that we'll have the notification of selected and non-selected applicants go out by mid-September 2022. And then we'll go into contract negotiations with the selected applicants September through October, and have the contracts executed in October. And then that will give plenty of time for programs to ramp up, ramp down, whatever it is based on those decisions. And we anticipate the contracts will start January 1st, 2023. And then I'll just share a little bit about funding priorities. This time around, it's not so different than it was previously. We're aiming again to really continue expanding the available services in King County, particularly to those communities and childcare provider types that where childcare health consultation has not previously been offered or made as accessible as it should be. So some of the focus communities are listed here. This is not an all-inclusive list, but some different ones to keep in mind. For example, the Hispanic Latino community is a huge childcare population and has not previously had services that are really tailored for their culture and language. Black African American communities. I distinguish this from Black African immigrant communities because those are very different experiences and backgrounds and language needs. Asian communities, Native Hawaiian, Pacific Islander communities, American Indian, Alaska Native communities, just in terms of kind of different cultures and ethnicities and races that might need tailored services. And then we also, again, want to focus on home-based childcare, like family childcare homes and family friend and neighbor caregivers, where they haven't typically been the focus of childcare health consultation services in the past. And then rural King County providers that, again, don't have as much access to services because of their geography. Another thing to consider for funding priorities is that we're seeking to fund culturally and linguistically appropriate services. And so this data is some that I got from Childcare Resources last year of the top non-English languages that are spoken or used by childcare providers in King County. That includes Somali, and these are in order by use. So Somali, Spanish, Russian, Mandarin Chinese, Oromo, Amharic, Vietnamese, Arabic, and American Sign Language. So that those are also considerations when you think about the focus communities you might want to serve. And then who is this RFP for? So same as before in BSK 1.0, it's open to nonprofit organizations, to community-based organizations, to tribes, and public or governmental agencies, certain communities in King County. And we especially encourage small nonprofits and community-based organizations to submit proposals. We also recognize that childcare health consultation is a very niche service area, so that requires a variety of different types of expertise. So in working in health and working with childcare providers and caregivers and young children and developing really community-specific approaches. So not one organization often has all of those skill sets that might make a really good team. So we encourage any partnerships and collaborations between multiple agencies to leverage each other's strengths if that seems appropriate. And if you do decide to apply as a partnership, there would be one lead organization that would submit the proposal on behalf of the entire partnership. And then minimum qualifications, we want demonstrated experience serving childcare providers and demonstrated experience serving the focus community, however that's defined by the applicant, and in their primary language if that's not English. Let's see, one question coming from Jean. What are the requirements for partners and contractors? Must they be 501c3? Can they be for profit? Phil and Hannah, I invite you to chime in. I believe they can be for profit in some cases. I know we were trying to push back on the 501c3 status requirement.
Yes, they can be for profit. That's
okay. Thank you so much, Phil. All right. And Hannah gave a thumbs up. Perfect. And then going into kind of what funded partners can expect. So one thing that's changing this time around, so this is for folks that are reapplying, you'll notice this change. We're building in a 6-month startup period for newly funded programs to work on design and development. And this is based on some feedback we received the first time around, where partners were funded and then expected to start services immediately. And that just wasn't very feasible, given that there were new programs. The staff needed to be hired, to be trained, clients needed to be recruited on all of that. So it takes some time to build up the program and to really develop it and to get it rolling. And so this time we're more intentionally building in this 6-month period, working with another strategy called innovation supports. And so they have a team of technical assistants and capacity building providers who will have a set of workshops that new partners will go through to really work on developing their program and give them the space to think very strategically and build up their program before having to fully implement it. And then there will be ongoing capacity building supports beyond that for another 2 years, again, working with this innovation supports team. And we're also partnering with the public health childcare health program that I mentioned earlier for their content expertise to help train up any new staff. So just a little bit more about these innovation supports I mentioned. There'll be these trainings and workshops. This will be run by a whole team of innovation supports, but there'll be one person assigned to each partner to provide more kind of individualized support to that partner. They'll provide tools and resources and co-design supports with the partners. And then they'll create opportunities for shared learning. So things like convening spaces where partners can share what they're learning as they engage with community to design these programs. And really, we want to focus on not just designing these individual programs for specific communities, but kind of building together this network and building a community within our partners throughout this process. So for any newly funded programs, so that means programs that would be funded for the first time through Best Starts for Kids Childcare Health Consultation, this first 6 months, January through June, of design and development is required. And then they'll go into early implementation and ongoing evaluation and adaptation with individualized supports from the innovation supports providers. And so in the first 6 months, there'll be a set of core program components. So these deliverables are products that to be created to really define their program model. So things like a theory of change, an evaluation plan, and materials for implementation. And then for what we're calling returning programs, so these would be partners that have been funded through the strategy before and are being refunded. This first 6-month phase is optional. We have 2 questions in the narrative questions of the request for proposals, where if you want to participate and use this as a time to kind of rethink your program, redesign it a little bit, you can fill in those questions and say that you are interested in participating and participate just as you would a new program. So that's January through June, and then again have these ongoing supports for another 2 years. For any programs that feel like, our program is well developed, we know what we're doing, we want to continue doing the same thing and get funding to continue doing the same thing, there's no need to fill in those last 2 questions in the narrative questions for the application. You would just go straight into, I guess what we're calling this like later phase of later implementation and ongoing evaluation and adaptation supports. And I want to highlight that, if you do fill out those last 2 questions of the narrative questions, or you don't, it doesn't really benefit or detract from your application in any way. It's more a matter of, does it make sense for where your program is at the moment? And then one other thing to highlight is returning programs, whether or not they participate in this 6-month design and development process, they will be expected to continue implementation of the services. So it wouldn't be a pause on all services for 6 months and then implementing again. It would be continuing to implement. As far as evaluation goes, funded partners can expect to spend some time partnering on evaluation. This is an expectation of all BSK partners. So you would be working with evaluators to create and refine a performance measurement plan, collecting data about your services and collecting data from providers about demographics and outcomes. You would be analyzing and reporting your data to Best Starts for Kids twice a year for our semi-annual reporting, and that data gets included in the annual reports that BSK puts out. And then you would be reviewing program data and using it to kind of inform your programming as well. So the RFP rating and review process is kind of the same process for all BSK requests for proposals. So the rating criteria is already included in the full RFP document, so you can look at that more closely. That's section 6, part A, and the review panel will be closely following the scoring rubric. All proposals submitted will have to go through the formal review process, and then there is also an appeals process that's outlined in the RFP. A few tips I wanted to highlight for the application is that there's one required document upload, which is the signed copy of acceptance of potential terms and conditions. So there's in the Zoom Grants library, you'll see a file that has kind of all of the what we call the boilerplate language, but all the terms and conditions that come along with any contract with King County. So you want to review that and then sign off on this document in order to submit a full application. Also in the attachments in the Zoom Grants library, I included attachment D, which is just the application information request section of the RFP in a Word doc form. So it's all the questions that you have to respond to in Zoom Grants. But this allows you to be able to take notes on your responses and be able to copy it and paste it in later. So a little bit helpful as a working document if you want to use that. And then you can also use the document section of Zoom Grants to upload any supporting documents you might want to include. So it might be things like a flyer or some data and charts that you might want to share. These will not be scored, but it's just a space there if there is something else you want to include. And then I also encourage you to just browse the Zoom Grants library for useful links and resources. So we pulled out some of the links that are in the full RFP as easy links you can access from the Zoom Grants library. And then as far as the budget, budget should be developed for the length of the contract term. So that's for 3 years. If there's going to be a partnership applying, so that's multiple individual organizations, we would need individual budgets included, so that can be uploaded in the documents section. And then the budget can the budget for staffing can be an hourly rate or FTE. It just really depends on your staffing structure that you're proposing. And then one more thing I would highlight is attachment E. This is another just a tool, not a requirement, but it's the budget long form template in Excel. It can be used as a planning tool, so you can kind of think in more detail about all of the different components of a program you might want to budget for. And then there's technical assistance provided. This is always free for Best Starts for Kids applicants. And it's really to support applicants and eliminate barriers that might prevent them from applying. And so if you're interested in technical assistance, you can contact our technical assistance providers through July 20th, 2022. And these providers can assist in determining the appropriate fit between your program and the RFP. They can provide guidance on how to best answer questions and where to find supportive data, and they can support an application review, including editing and budget review. But technical assistance is not grant writing. And then I'll pause here. I know we have, I think, 2 of our technical assistance partners on the call today. Let's see, I think, Jing, do you want to introduce yourself first?
Sure. I'm Jing Fong, and I'm with RHL Consulting. And I encourage all of you to use technical assistance resources, even if you are or have a grant writer at your fingertips to help you with this application. The beauty of it is that we meet you where you're at and help decipher, answer any questions that can help you write the strongest grant that you can, and help you with looking at the rating criteria or the other requirements. And sometimes it's just a lot of information to absorb. So any question is a good question, especially if it helps you write. And I know for some people the writing aspect is challenging, but we can help you with that. And any one of these consultants are great.
Thank you, Jean. And Jean, you're from RHL Consulting, is that right?
That's right. Right.
Perfect.
Thanks.
And then let's see, we also have Lauren. Lauren, do you want to introduce yourself and your group?
Sure, absolutely. So my name is Lauren Jones. I'm with Inclusive Data. And so we're TA providers for Best Starts for Kids. And like Jing was saying, it is a really great opportunity for you to get help with your proposals, to get help with visioning, goal setting, strategic planning. We can look over your proposals and help you, leaving comments and suggestions for edits you should make. We do teach-ins and collaborations. We can help you do data searches. There's a lot that we can help do to support you to make the writing process easier. Even if we can't quite write for you, we can definitely do some of the heavy lifting with the other aspects of grant writing. So I strongly encourage you to reach out if you're in need of some support. There's no such thing as a bad question, like Jean was saying, and we're happy to help. Thank you.
Lucy, can I add one thing?
Sure, yeah, go for it.
I encourage you also, and I think Lauren will agree with me on this too, to reach out earlier than later, because oftentimes some of those questions it takes a lot of time and work to work through those. And the earlier you do that, the better, the more time that you have. So you're not feeling so rushed to meet the deadline.
Absolutely.
Great, thank you both. So as you can see, we have really amazing TA providers, and this is just 2 of them. We have a whole set of organizations that can help with the technical assistance for applications. And so I just pasted the link in the chat. There you can kind of browse the different groups that are available, and you can reach out to folks directly if you want to get technical assistance with them. All right, and then I think this is one of my last slides. So any additional resources we have, again, I wanted to highlight the Lunch and Learn that's coming up July 7th. We also have a link to the Child Care Health Consultation Open House that happened back in March for anyone who's interested in watching that back. So that included some of our current partners sharing about their work and their program models. So if you're interested in learning more, that's a good resource. And I'll paste the link in the chat right now. And then any questions you have after this, please email them to Phil. That's PHI Thompson THOMPSON at kingcounty.gov. Phil, do you want to introduce yourself really quick?
Sure. I'm Phil Thompson. I am the contract specialist for the BSK program. And for this RFP, I will be your primary contact and who you should call and talk to. Please do not try and contact Lucy after this is done, as that will be a violation of the separations. So if you have questions, email me and I will get them answered for you.
Thank you, Phil. And then, yeah, so that's Phil. And then again, you can contact technical assistance providers directly for support, sooner the better. And then we also have a glossary of terms. If there's any terms we're using throughout the RFP that folks are unfamiliar with, that's also included in the RFP. Okay, and I think that's it. So any questions? Hannah, are there any questions I might have missed in the chat? We can start there.
Yes, there's one question from Jing. It says, I'm thinking from the perspective of an applicant who hasn't participated in 1.0. They're new and small. How many of the grants, with parentheses, percentage and number range, will be awarded to returning to, and then the question mark, and then to new, and then for returning participants, can they continue doing their work, or are they expected to propose something that builds or expands their current work?
That's a great question. Thank you, Hannah, for reading that out. So for a new applicant that didn't participate in 1.0, and how many grants will be awarded to returning versus new, I don't think there's any defined amount. I think ideally we'll have a group that's a mix of some returning partners who have a lot of history with the work and have been doing it very effectively for a long time, and some new programs that have really innovative ideas that are able to reach communities that we haven't been able to reach previously. So the priority is more of having a kind of expanded reach in terms of the communities we're serving, in terms of languages we're able to provide services in, and geographies and different needs that we're addressing, different provider types. So just having that kind of, yeah, just kind of diversity in that aspect. So the weight isn't necessarily on whether they're returning or new. For returning participants, you can definitely just propose to continue doing your good work and explain why that work is effective in your application. You don't necessarily need to propose doing something entirely different or expanding the work. If you're in a place where you want to do that in your proposal, you're absolutely welcome to, but that wouldn't be an expectation necessarily to make it a compelling application. What we're really looking for, again, is, you knowing who your focus community is, being able to prove that you're the ones who should provide those services and how you can do it very effectively. So we're looking for compelling proposals in that way. Does that help? Awesome. Are there any other questions I might have missed in the chat? No? Okay. Any questions that anyone has right now?
Oh, actually, I should say this question in case someone is not looking at the chat. There was a question from Sylvia. It was for previously funded applicants. Will they also participate in ongoing capacity building supports for innovation?
No, I got that answered.
Yes, yes, I know you got it answered, but I wanted to let everyone know the answer to that in case they weren't looking at the chat, or missed when Lucy was talking about it. And that's just, no, it's optional. That innovation supports are optional for whomever has been previously funded.
Yeah, and I would just add to that, that especially that intensive 6-month period is definitely optional. Then the innovation supports kind of that ongoing 2-year piece that I showed in the diagram, that's also offered to returning programs, and it's just based on the needs of how often they tap into them. And then there will continue to be kind of convenings and like learning opportunities across all of the programs, returning and new, for folks to engage and learn from one another. So there will still be some engagement with innovation supports, but it's not strictly required. Anything else you would add to that, Hannah?
No, that was perfect. And then we have a new question that came in. Given difficulties with hiring, wondering what flexibility for proposing new hires, but understanding may be difficult.
Yeah, what flexibility is there for proposing new hires? Yeah, I mean, I think, in your proposal, you can build out the staffing the way, you would want it ideally for the program. I think one of the things we were trying to do with having the decisions made early in mid-September and having the contracts start in January 1st is to have that kind of quarter of room to even start the hiring process if you know that you're going to be refunded and how much you'll be refunded for. So you can at least get that out there. I know it's hiring right now is taking even like up to 6 months, even longer in some cases, depending on the roles. So you can, as soon as you know that you're going to get funding, you can start that process early, but also knowing that, you know, it could take longer for returning programs, especially since you're expected to be delivering services right away. January 1st, I think that can still be negotiated, and that kind of contract negotiation process, September and October, just like what is feasible based on how the team looks at that point and the hiring landscape at that point. We could still have more of a kind of building up process if the hiring is taking a little bit longer than anticipated. And so that will just be, again, negotiated in more detail once we get to that point. Any other questions?
I actually have a question. I can't type fast enough to put in the chat.
No problem.
For returning organizations, if they should be fortunate enough to be awarded this grant, if they opt out of the planning period and are expected to start right away, does right away mean right away, or does right away mean January or any time between July and January?
Lucy, you're on mute.
Sorry, muting myself because Jim was talking. Thank you, Hannah. Yeah, so right away would mean the start of the contract period, so January 1st. And so currently the partners that we have active partners that are funded through December 31st of this year. So that would just mean that they continue doing the work that they're already doing January 1st. We wouldn't want there to be a pause in services if they're being refunded. Any other questions, clarifications? All right, well, if not, I just want to thank you again all for being here and being interested in this opportunity. If you have further questions, you have the contact information for Phil. So all questions should go through Phil. And let's see, I think I have one more slide here. If you want to learn about any other Best Search for Kids opportunities, there's this little QR code that our communications folks put together where you can view our funding calendar and subscribe for updates. And then this session is recorded and it will be posted up probably early next week, the recording and the slide deck on the Best Search for Kids blog. And I will post the link in the chat here. There's a page of all of the recorded info sessions for the RFPs that came out April through June. So you can look for that there. All right, well, thank you, everybody. And Hannah, you can stop the recording now. Thanks.